may not talk as loud as him, I don't know. My name is Farr. I'm the county nurse manager here at the Lamar County Health Department. I have the pleasure of having watched Rock Springs grow from the beginning, and I feel like that is one of the most undiscovered secrets in our community. We are very blessed to have them because they complement what we do locally. There's also another clinic I want to make sure I share with you here in town called Your Town Health.
Your Town Health.
That is a federally funded clinic, and they service uninsured, underinsured, and insured at a lower cost. Okay.
Your Town Health.
If you do have health insurance that's difficult to use in some places, then for long-term care needs, then Your Town Health would be the place to reach out to. They are through a federally funded clinic called the Palmetto Health System, and their office is behind the library in that little business strip there behind the library on Thomas Street.
And Sherry, is that a place where people can go if they have like high deductibles or high co-pays or high and cannot afford it? Yeah. Okay. Awesome.
If I may be wrong because they are
different, separate.
They're different, and I don't work for them, but I would tell you to try that.
Okay.
So with public health now, I work for the health department. We are a state entity. Our Lamar County Health Department is one of 12 within our LaGrange Health District. It's a very, most of you probably know more about us now since the COVID horror story went through, because that's when we kind of came to life for the public. But we've always been there. We're there to do preventative things, okay?
Yes.
We're there to help prevent. So we're there to educate you on how to take care of yourself. From the time you are this high to the time your hair is grayer than mine and you are ready to go meet your maker, okay? We're there to help with all of those educational needs. The main thing that most of you probably know about public health is we do immunizations, okay? So we immunize from birth to death, okay? We immunize uninsured, we immunize insured. So we can, there are a few insurances that we cannot bill for, and we will tell you that up front, and we will tell you where you should go for that. So if you are in need of vaccines, whether you're looking for your children, for your teenagers, for yourself, we are the place to come. Now, vaccines kind of have taken a big hit here lately, particularly after COVID epidemic. But know that vaccines are there to help prevent us, and they are known to wipe out things that could wipe us out, like measles, mumps, rubella, polio, smallpox. You're there to chicken pox, and those things are required for our kids in school. Well, they're required, and of course there are ways around those requirements, but we're there to help with all of that. We also do a lot of health screenings. A lot of our work is around women's wellness, our young women of childbearing age and our older women around breast and cervical cancers. And so we're there to help whether you're uninsured or insured in both of those capacities. We help with HIV prevention, testing, counseling. We help with general lab work. If you have a doctor's order from your lab, from your doctor, you can bring it to us, and we can do those labs at our cost, which is much cheaper a lot of times than it is for you at a different place, unless you go to them.
Then it's free.
Either way. We do blood pressure screenings, okay? We do scoliosis screenings in the school. We just finished those for our 5th graders and our 7th graders. Scoliosis is a curvature of the spine that can cause you, different type of issues as you grow older, and so we just finished doing that with our kids. We are the ones who take care of things nobody else wants to take of, like our sexually transmitted infections, our TB and things like that. And tuberculosis is alive and well in all our communities. Yes, we are the ones who deal with all of that. we are, I'm going to tell you, I know nobody likes to talk about sexually transmitted infections, but we have Gordon State, and we have teenagers, and we are people, and we make irresponsible decisions sometimes, so we're there to help. But we have some really dynamic ways of testing and treating in Lamar County that are different than other counties. You can walk in our office and you can get screened for almost every STD there and know your results and be treated before you walk out the door.
That's awesome.
Which doesn't happen everywhere. That's because we found grants to get special testing abilities to do that. So, not to wave our dirty laundry, but that's nice to not have to wait 2 weeks to find out and have
get it treated right away.
and it's treated right away.
That's awesome.
I talked about women's health, like we do pregnancy prevention, you know, and help people plan for having children. Now, I see all these kids around us,
All these babies.
and we know they are such a blessing to us, okay?
Yeah.
But it's not easy. And you have to plan to have a healthy pregnancy. You got to have a healthy family, economically, psychologically,
They cost money.
physically.
Yeah.
You got to be prepared. So we're there to help prepare so that you can better plan for when you want that pregnancy. You know the number one health issue for young women of childbearing age is an unplanned pregnancy. It's the most dangerous thing that you can go through.
Yeah.
It's the most dangerous thing because we as young women, and I'm not young anymore, but we don't take our health. We don't go to the doctor. We don't do things like that, okay? And then you find out you're pregnant, boom. And you go in there and you find out you got high blood pressure. Well, I didn't know I had high blood
Got
pressure.
diabetes.
Or you got diabetes or something like that. And you can really have a big problem, and it's not just you. Now we got a little one that we're taking care of. So we're there to help plan to help you better plan for that. We offer, right now, through the state, we can give birth control pills at no cost to anybody, okay, who is in our program. And we have the ability to put in IUDs, Nexplanons, and take those out as well, too.
That's awesome.
Yeah, and we're the ones who help put our young women on Medicaid for their pregnancies.
Yes.
Now, you may think that's not a big deal, and it's really not. It's a piece of paper that you go through and you fill out and you get you on Medicaid to help cover for your prenatal care. But what you don't know behind the scenes, well, some of you do know, but when you come in and see us, you also see a registered nurse who takes 45 minutes to an hour with you to talk to you about your health needs and where you need to go from there after pregnancy. And it may not stick because there's a lot of information that comes through there, and something's going to stick. And then we're going to call you back and check on you like that. We also do children's health. We do wellness checks on kids. We are the only health department in the state of Georgia that runs a school-based health clinic. We go into our schools. It's not a true health clinic. We go into our schools and we at the primary and elementary schools, and we offer wellness screenings for those children. Those children miss 15 minutes of class. Those parents don't miss work. We communicate the findings back to the parents. We communicate the findings to their doctors.
That's awesome.
And that's what they do. We see about 100 kids a year through there. We don't do it just on everybody. You as a parent have to sign them up. We call you, we say we're going to do this, and that's what we do.
That's awesome. So the parents don't have to take off work to get the kids seen. Yeah. That's awesome.
We have a car seat program where we can help you with car seat education, keeping your kids safe in the car. If you're eligible, you can get a free seat during that program. And those wellness checks don't stop just at elementary school. We can do those at middle school and high school at our offices as well too. I never took my kids for wellness checks, I'll be honest. Once they hit about 8 years old, I was like, they're okay. And I know now that's not true. They should go every year to do a wellness check so that when they are ready to have children, they already know about what health issues they may have. You know, so that's called prevention.
You have murmur.
And a part of our program there at the health department is WIC, our Women, Infant, and Children Nutrition Program. Most of you know about that. If you're a woman with a baby or a child up to age 5, if you reach by your income requirements. You can have food assistance, and most importantly, nutrition education about how to stay healthy. And then we have an environmental health program, which is totally outside of my expertise. But they're the ones who inspect your food, your restaurants. They inspect wells, water supplies, tourist accommodations, which I know we don't have a lot of tourist accommodations, but they do inspect those. They deal with rabies, bites. If someone gets bit, they deal with that. They deal with building and building things like your septic permits and things like that for your homes. So they do a lot of care. They do the lead inspection. So if there's a child who has an elevated lead level through the clinical, then there is a program there where they can have a home inspection done to see if there's risk in those homes. And just a few other things. The dental clinic, Lamar County is one of 2 health departments in our health district that has a dental clinic. It's for underinsured or uninsured kids and adults who meet the financial criteria, and that includes our Medicare age people. Medicare does not cover dental care, so if they meet the financial qualifications, they can be seen for a basic dental cleaning and just basic dental care. They can extract teeth and things like that. For our kids, we had to talk about them a little while ago. Right now, there's always a waiting list, but you get on the list, get applied, and if somebody doesn't show up, and notoriously people don't show up, you can get called in early. Now, I want to tell you about 2 things we have in Lamar County that's different, okay, that I'm very proud of. We are part of 2 grant initiatives. One is called the Live Healthy Lamar. It started out as a low birth weight grant. We received money through the Kaiser Foundation. Unfortunately, Lamar County is known as one of the counties in the state of Georgia with babies born under 5.5 pounds. That's too tiny. Those babies have complications. So this program that we've been doing for 13 years helps to improve the health of our young women of childbearing age, so they have healthier babies that are not born at a low birth weight. So we have a group that works together and gets health information out. We have a case manager who connects over the phone and talks with those young mothers who are pregnant, young mothers who have delivered a baby who's under 5.5 pounds, and we try to follow them for 2 years to help keep that from occurring again. And what's real near and dear to my heart right now is our dementia work that's going on here in Lamar County. We are one county in the United States, one of 10 counties in the United States who received a $40,000 grant to work on dementia care in our community and surrounding areas.
That's awesome.
So we have been working very hard for the past year to build this program, and so we started. We have partnered with a group out of Emory University and some other offices called the Georgia Memory Network to allow for our senior citizens in particular who are exhibiting signs of dementia to be able to, through their primary care doctor, be referred to the Georgia Memory Network, and they are connected telehealth virtually to a neurologist within 2 to 3 months of the referral, whereas if you have to go face-to-face, it would take 9 to 10 months to see a neurologist. That neurologist assesses them over the telehealth, orders the labs and the diagnostics that they need, meets back with them in about 2 months with a plan of care, and then communicates that back to their primary care physician who manages their care. And I don't know if you, Dr. Long probably knows, but with dementia, there's a whole lot of good things on the horizon on how to slow this down and how to better treat things. We don't know that. This is new for us. This is new for our doctors in the community. It's new to you. But our African American population is one of the highest people with dementia. And in the year that we've been doing the Georgia Memory Network, we've seen no one of the African American population referred through the Georgia Memory Network. So I know we're missing out on something, but because the community work that we've done, the meetings we've had a large contingent there who have learned that we're not reaching those people. And I know y'all know Mr. James Butler here in town. He tells us, and I'm this same way. We're very private. Yeah. We don't like people to know what's going on with us. But I'm telling you, dementia can be slowed down.
Yes. Yep. Medicines
and our programs can help you as caregivers better care for your people. We also have a caregiver support group that has started that has been meeting for 2.5 months now. Every 2 weeks we have about 10 people who come to that. Awesome thing. So I just want to share all that with you. We do, I know your people with Full Circle of Hope are looking for volunteer hours. These two initiatives are something you can help with because we need help sometimes. So if you're interested in your organization will allow them to serve as some of your service hours, we will be willing to help you.
Oh, excellent. Yeah, so we can do that too. So people looking for hours for this event.
Now,
for them to share, like if you don't have anything, we can do that too. Because we're trying to, because for the parents, they have to get the 10 hours in before the event. And you attend this, and then they have to get the 10 hours in. So we're definitely, if they're in need of hours, we can definitely do that.
Work with you on this. So that's a lot of stuff. I know I shared a lot. We have a lot to share between all of our organizations. We all love what we do, and we love our community. And it's all about helping you guys. I got 5 more years to help you, and then I'm going to help you.
That's it.
And I'm going to give you my all for those 5 years.
5 more years, that's it.
I might go sooner, but 5 right. But what questions might you have?
I actually have a question. In regards to your dental clinic, I know you were saying that it's open for kids, but you said it's also open for adults, like who may need to get a tooth pulled or get something who don't have dental insurance.
No dental insurance.
Now let me tell you this. I told you there's a waiting list. It's about 3 to 4 months waiting list. If someone has a problem,
yes,
they need to say that when they contact.
I got you.
They need to tell us, I've got this. I think I've got an infected tooth or something.
Yes.
They will work to try to get them in
sooner.
Okay. So to make an appointment, if you pick up one of our cards, you can go online and schedule your appointments at the time that's convenient for you, or you can call. Yes. And if you call, you're going to get a call center. You're not going to get us. Okay. If you want us, it'll tell you what number to mash, but I'm not going to tell that to you because we don't want everybody to call and keep us from taking care of you when we're out there. The online is great. So anything else?
Does anybody else have any questions about services that are available at the health clinic, at the health department?
We do take insurance. Like I said, most insurances. We don't take TRICARE and a few others, but we do take insurance.
Awesome.
You also install car seats.
We help you learn how to install. Your car seat.
You're going to help. You're going to show us how to do it.
Oh, baby. We do. And there was one other question, somebody said. Volunteer hours.
Yes.
For students. Because we're a state agency, we have rules for that. Okay.
Yes.
So if our district has to have a contract with the school that they're working with, so we do a lot with Gordon State and we do a lot with Southern Crescent, and we've done some other students as well. However, at our community events, we will use students to help. We don't let the high school students come into our clinic to help because a lot of what we do is very private.
Yes.
But they help us at the schools with our wellness checks, and they help at other community events.
Of course I can't remember now, right?
Well, I'll be here for a few minutes.
Oh, I had a question. Oh, you was talking about car seats. That if a family does not have a car seat, is that something that they can get also at the health clinic? Or
You can. All right. So the way the program works is it's an educational program.
Yes.
If you don't have to have this, but if you qualify for WIC, Peach State, Peach Care, you have to come. You have to participate in a class, and you will get a seat.
that's awesome.
Now you're not gonna get a carrier.
Oh,
You're
awesome.
not gonna get a carrier or infant carrier because that doesn't last
No,
you
it's a
long.
big old car
You're gonna
seat.
get this big old seat that's good for 5 pounds to 60 pounds.
That's
Oh, wow.
And then we have a booster seat.
Yeah,
from
for the
4
older
those
kids.
who are ready for that. So we have those available. Yes.
That's awesome.
But you do have to be. You
Eligible.
can't just walk in the door and get a seat. You got to participate in the education.
We understand. Yes. I mean, well, that's so awesome. And I bet people just don't know.
I know. I didn't know about the dementia program. So if someone were to come in, how do they register to be a part of the dementia program?
To be seen
Yes.
as a patient, they need to be referred through their primary care. But if they can call the office, and one of us will give them what they need to take to their primary care.
Got it.
So they can fill it out. Or you can go online to the Georgia Memory Network or to our website, and it'll link you to the paperwork.
Okay. And what's the website address?
It's district4health.org.
District4health.org.
And then you look for Lamar County.
Okay.
And in regards to the dementia program, do you have to have insurance in order to be able? So if it's someone, I know you were saying like you needed a referral from your primary. Some people won't have a primary if they don't have insurance. Okay, you have them find a primary care, and then even if they go to Rock Springs Clinic to do it, and then they can still do the dementia program. Thank you.
We're there to help.
Excellent, I love it. Any other questions, anybody? No. Awesome, thank you
Thank you so
much.
much.